When we initially approach the sheep, what we're looking for is how it's responding to its environment, not how it's responding to us. We're looking at its posture, its wool coat. We're looking to see whether there's any sign of discharges, whether it's salivating. We're looking to see whether it's eating, whether it's chewing its cud, and basically whether it is behaving in a way that we expect. And as we approach it and become closer to it, we're seeing how the animal responds to that and whether it is safe to continue approaching it both for ourselves and for the animal. We're looking at its back end to see whether there's any fecal staining. We're trying to see if there's any feces in the pen that is being held in to see whether there's any sign of diarrhea or whether those are normal.
To take the body condition score of a sheep, you're feeling primarily over the loin. You're feeling the spinous processes and the transverse processes. You're feeling whether you can get your fingers in between the transverse processes, whether you can get your fingers in underneath the transverse processes, and you're feeling the prominency of the dorsal process. You're also feeling whether the muscle is convex, concave. Supplemental information can be got by feeling over the ribs, how much of a fat cover is there, how bony the pelvis feels, how much muscle there is there. And in very fat animals, the stump is one of the last places to get a good covering of fat. What we do whenever we get to the head end is I normally start in the mouth. What I'm looking for is whether we've got a full mouth, which is 8 adult incisors, which we've got in this case. I'm looking for lesions on the dental pad. I'm looking to see that the tongue is moving as I would expect and is nice and soft with decent tone, which I've got here. I'm checking the back teeth by having a feel along the maxilla, but also the lower jaw and mandible. You're getting an idea of where the tooth roots are, and if you've got abnormal molars, premolars, normally there will be some distortion of the roots. We move on to the abdomen. The main thing we're examining in the abdomen is the rumen, and that's in the strip below the paralumbar fossa, just caudal to the ribs. Again, same as in cows, we're feeling for a gassy cap at the top, then we're feeling for a matte layer, and then we're feeling for a more firm fluid there at the bottom. So we're feeling that that is full, we're feeling that it has got those layers as we would expect. Then we're going to have an auscultate of it. While we're auscultating it, we're going to also have our hand on it so we can feel the ruminal contractions. And we're listening to the quality of those contractions, and we're also feeling for the quality of the contractions. And at this point, you have to listen probably for about 2 minutes to get a reasonable idea of how quickly the rumen is turning over. Finally, whenever you're listening on the left-hand side, what you want to do is check for any signs of gaseous distension. One can check for gaseous distension in the rumen by pinging. And what you're listening for is reverberation. It does become more difficult if there's more wool. With some sheep you can still part it. And on the right hand side, again you're looking for, or you're trying to listen for gaseous distension. So that's potentially increased gas in the small intestine or cecum. And it again is similar to in the cow where you are pinging